For 30 years, I was trained to believe one absolute truth in medicine, a truth that was drilled into me through medical school, through residency, through decades of practice, through conference after conference, and textbook after textbook. That truth? Blood pressure must be below 120 in everyone. No exceptions, no nuance, no individuality. Just one magic number that was supposed to apply to every single human being on the planet, regardless of age, genetics, lifestyle, or biology. I prescribed medications to hundreds, no, thousands of patients chasing that number. I believed I was protecting them. I believed I was following the science. I believed I was doing the right thing. Then came the day that changed everything for me. Mr. Bernard, 76 years old. A retired Air France pilot with the posture of a military general and the spirit of a man 20 years younger. He still rode his bicycle through the countryside. He tended a garden that he was proud of. He was sharp, active, autonomous, and full of life. His only problem, according to the medical guidelines I had sworn by for 3 decades, was that his blood pressure had crept up to 149. So we did what doctors do. We prescribed 2 powerful antihypertensive medications and brought his blood pressure down to a textbook perfect 117. 3 months later, Mr. Bernard fell in his living room and shattered his hip. His blood pressure had been perfect, and that perfect blood pressure had been quietly, invisibly, systematically killing him. What I'm about to reveal to you today about blood pressure after the age of 60 is going to challenge and possibly completely contradict everything your doctor has told you. But it could save your life or the life of someone you love. So I need you to stay with me until the very end, because I'm going to give you the exact blood pressure numbers that are truly optimal for your age, and I'm going to explain, with real science, real studies, and real patients, why aiming too low can be just as deadly, and sometimes even more deadly, than aiming too high. Are you ready? Because this changes everything. Your body after 60 is not the same body you had at 30. I know you know this. You feel it every morning when you wake up. You see it in the mirror. You experience it in your energy levels and your recovery time. But what most people don't realize, what most doctors refuse to fully accept, is that these changes are not failures. They are adaptations, biological realities. And when we ignore them, we cause tremendous harm. Here is the biological truth that the conventional medical establishment has been woefully slow to acknowledge. Your arteries change as you age. They become progressively less flexible. They stiffen. They lose the elastic rubber band quality they had when you were young. And here is the crucial part. This is not a disease. This is not a failure. This is the normal, natural, inevitable process of human aging, and it happens to every single person who lives long enough. Now, because your arteries are stiffer, your heart must work slightly harder to push blood through them. It needs to generate a slightly higher pressure to ensure that blood, oxygenated, nutrient-rich, life-sustaining blood, reaches every organ in your body. Your brain, your kidneys, your heart itself, your eyes, your muscles. Every cell that depends on that constant rhythmic delivery of what it needs to survive. Your body, in its ancient wisdom, has already figured this out. It has already adjusted. It is doing exactly what it is supposed to do. But then we arrive with our medications. We look at the number on the blood pressure cuff. We see 138 or 142 or 149, and we panic. We pull out the prescription pad. We push that number down. down to what it was when you were 35 years old, and we congratulate ourselves on a job well done. What we are actually doing in many cases is the physiological equivalent of this. Imagine a water pipe that has built up some mineral deposits over the decades. The flow is a little reduced, so your water pump naturally increases its pressure slightly to compensate, to make sure the water still gets where it needs to go. And then someone comes along and forces the pump to run at the same low pressure it ran when the pipe was brand new and completely clear. The water doesn't arrive anymore. The plants at the end of the pipe wither and die, and everyone stands around wondering what went wrong. That is what we are doing to millions of elderly patients, right now, today, with medications that are being prescribed with the best of intentions, but without adequate consideration of the irreversible biological reality of aging. Let me tell you what happened to Mr. Bernard when I finally examined his complete medical file at the hospital. His blood pressure had been held at 117 with his medications. For a 76-year-old man with naturally stiffened arteries, this was catastrophically low. His brain was being chronically underperfused. It wasn't receiving enough blood, which meant it wasn't receiving enough oxygen. His kidneys were struggling. His entire body was operating in a state of quiet, invisible crisis, a state that had no dramatic symptoms at first, just a slow erosion of everything that made him himself. He felt constantly exhausted. He had dizzy spells every time he stood up from his chair. His memory was beginning to slip in ways that frightened him. He was losing words, losing the thread of conversations, forgetting things he had known for decades. And then one morning, walking to the bathroom at 3 a.m, the dizziness came and he didn't catch himself in time. The fall, the hip, the 6 months of rehabilitation, the loss of independence, the beginning of cognitive decline that would accelerate over the following year. When I gradually reduced his medications, very carefully under close medical supervision over several weeks, the transformation was extraordinary. His dizziness disappeared, his energy returned, his memory sharpened, his blood pressure settled naturally around 138, and he never fell again. 138. The number that had sent his previous doctor reaching for the prescription pad was the number that was saving his life. Now let's talk about the research, because this isn't just my clinical observation. This is now backed by some of the most significant and rigorous medical studies of the past decade. Studies that have fundamentally shifted how the most forward-thinking physicians in the world are approaching blood pressure management in older adults. The SPRINT trial. You may have heard of it. It made massive headlines when it was published, and doctors all over the world cited it as evidence that intensive blood pressure control, getting that number below 120, was the way to go. The media ran with it. Patients brought printouts of the articles to their doctor appointments. It seemed to settle the debate. But here is what the media didn't report. Here is what most doctors never read, because they stopped at the headline and the abstract and never dug into the actual data. The same study, the very same SPRINT trial, showed a massive increase in serious adverse events among participants over the age of 75. More falls, more hospitalizations, more kidney problems, more episodes of dangerous fainting, more acute kidney injury, more severe low blood pressure, more confusion and cognitive disturbances. The cardiovascular benefits that generated the headlines were largely canceled out in older adults by these cascading, devastating side effects. The study was more complicated than the headline suggested. It almost always is. Then there's a landmark study published in the Journal of the American Medical Association that followed more than 4,000 older adults over 8 years. 8 years of careful, rigorous data collection. And the results were, to many physicians, shocking. Older adults whose systolic blood pressure sat between 130 and 140 had a lower rate of overall mortality than those whose blood pressure was artificially maintained below 120 with medications. Lower mortality. A slightly higher blood pressure was associated with better survival, better quality of life, fewer falls, and better cognitive function. Let me say that again, because I want it to land. In this major, peer-reviewed, long-term study, the seniors with higher blood pressure were living longer and living better than those whose blood pressure had been aggressively lowered. This is not fringe science. This is not alternative medicine. This is published, peer-reviewed research in one of the most respected medical journals in the world. Why does this happen? There are 3 major reasons, and each one is critical to understand. Your brain is the most metabolically demanding organ in your body. It makes up only 2% of your total body weight, and yet it consumes approximately 20% of all the oxygen you breathe. Every breath you take, 1/5 of the oxygen goes straight to keeping your brain alive and functioning. To get that oxygen there, your brain needs a constant, robust, uninterrupted flow of blood. And it needs that flow to be under sufficient pressure to actually push through the network of aging, stiffening cerebral blood vessels and reach every neuron that depends on it. When your blood pressure is too low, when medications have forced it down to levels appropriate for a 30-year-old, but not for a 75-year-old, your brain begins to quietly suffer. It doesn't announce this dramatically. There's no siren. There's no sudden collapse. It's subtle, insidious. It creeps up on you. First comes the brain fog, that sense of mental haziness, of not quite being able to grasp a thought before it slips away. You start a sentence and lose where you were going. You read the same paragraph 3 times and still can't absorb it. Then comes the memory loss. Not the dramatic, sudden memory loss of a stroke, something quieter. You walk into a room and can't remember why. You forget names you've known for years. You misplace things constantly. Then comes the difficulty concentrating, the increasing confusion, the growing sense that your mind is not quite what it was, and the terrifying possibility that this might not be normal aging at all, but something worse. Multiple studies have now established a direct link between chronically low blood pressure in older adults and an accelerated rate of cognitive decline, including a significantly increased risk of dementia and Alzheimer's disease. We spent decades telling people that high blood pressure was the enemy of the aging brain, and it can be at truly dangerous levels. But the pendulum has swung so far in the other direction that we are now creating a generation of seniors with medication-induced cognitive impairment, and far too few people in the medical establishment are willing to acknowledge it. Your kidneys are among the most remarkable organs in your body. Every single day, they filter approximately 180 liters of blood, cleaning it, removing waste products, regulating your electrolytes, maintaining the delicate chemical balance that keeps you alive. To perform this miracle of filtration, your kidneys require adequate blood pressure. Without sufficient pressure, it simply doesn't work properly. Now here is the profound, almost cruel irony that I need you to truly grasp. The primary reason most elderly patients are prescribed antihypertensive medications is to protect their kidneys. And this is a legitimate concern. But if the medications lower blood pressure too aggressively, if they push it below what an aging body needs to maintain adequate filtration pressure, those same medications designed to protect the kidneys begin to destroy them. The medication meant to save the kidneys was killing them. The treatment was the disease. Now, falls. This is the one that should terrify every clinician who works with elderly patients, and it doesn't get nearly enough attention. Falls are one of the leading causes of death and permanent disability in people over the age of 65. A hip fracture after the age of 75 is not just painful. Statistics tell us that 50% of older adults who fracture their hip never fully regain their previous level of independence. And 20%, 1 in 5, will be dead within the year. 1 in 5. And one of the primary mechanisms by which blood pressure medications cause falls is through orthostatic hypotension, a sudden dramatic drop in blood pressure that occurs when you stand up. You've been sitting in your armchair for an hour. You stand up. Your blood pressure drops suddenly and sharply. Your brain receives less oxygen for a few seconds. The room tilts. You reach for something to steady yourself, and sometimes you find it, and sometimes you don't. A study conducted in France showed that elderly patients whose systolic blood pressure was artificially maintained below 120 had a 43% higher risk of suffering a serious fall requiring hospitalization. 43%. This is an enormous, clinically significant, potentially life-ending increase in risk that we are causing with our prescriptions. Now I want to walk you through the 3 most dangerous mistakes I see in blood pressure management in elderly patients. These happen every single day in doctors' offices around the world. Mistake number 1, measuring blood pressure only at the office. Here is what happens. You walk into your doctor's office. You're a little anxious. The white coat, the clinical environment, all of this activates your body's stress response. Your blood pressure rises, sometimes by 10 points, sometimes by 20, sometimes by more. This is called white coat hypertension, and it affects a substantial percentage of people diagnosed with high blood pressure. I had a patient, Mr. Jacques, 72 years old. Every time he came to the office, his blood pressure read 161. His previous physician had put him on 3 antihypertensive medications. 3. He came to me experiencing constant dizziness, chronic fatigue, and significant cognitive impairment. I asked him to measure his blood pressure at home for 2 weeks. His readings were consistently around 138. Not 161, 138. He was being damaged by 3 medications he didn't need. We carefully reduced them. The dizziness lifted. The fatigue cleared. His mind sharpened. He got his life back. Mistake number 2, never measuring orthostatic blood pressure. This is a simple 3-minute test. Measure blood pressure lying down, then immediately after standing. A drop of more than 20 points is clinically significant and almost certainly explains mysterious dizziness, lightheadedness, and near falls. If your doctor has never done this test, they may be missing the most important piece of the puzzle. Mistake number 3, ignoring medication interactions. Many older adults take 5, 6, 7 or more medications simultaneously. And an alarming number of medications that are not prescribed for blood pressure can nonetheless significantly lower it. Certain antidepressants, alpha blockers for the prostate, pain medications, Parkinson's medications, even some herbal supplements. If no one is looking at all of your medications together, the cumulative effect on your blood pressure can be disastrous, and no one will connect the dots until something catastrophic happens. So what is your ideal blood pressure after 60? Here is the truth. There is no single magic number. Your optimal blood pressure depends on your specific age, the condition of your arteries, your kidney function, your cardiovascular history, and, critically, how you actually feel on a daily basis. That said, here is what the evidence increasingly supports for the large majority of healthy older adults. A systolic blood pressure between 130 and 145 is not just acceptable, it may be optimal. Not 119, not 115, not 108. These numbers in an otherwise healthy 70 or 80-year-old are not achievements. They are warning signs. The signals that your blood pressure may be too low include persistent, unexplained exhaustion, dizziness or lightheadedness when you stand up, memory that feels noticeably worse than a year ago, difficulty concentrating, that feeling of thinking through wet cement, episodes of near falling or actual falling, and a general sense of weakness and diminished capacity that doesn't match who you know yourself to be. If any of this resonates with you, please have an honest, thorough conversation with your physician about your medications. Bring your home blood pressure log, ask questions, insist on being heard. Here are the practical steps you can take right now. Get a good blood pressure monitor and use it at home. A quality device costs between $30 and $60, a trivial investment compared to the cost of a medication-induced fall or years of declining cognitive function. Measure twice daily, morning before medications, evening before dinner. Record every reading. Bring that log to every doctor's appointment. This data tells a story that 3 measurements per year in a clinical setting absolutely cannot tell. Talk to your doctor honestly and completely about your symptoms. Don't minimize, don't edit. If you've been dizzy, say so. If your memory has been slipping, say so. If you've caught yourself on the edge of a fall, say so. These are not complaints, they are diagnostic data. Ask your doctor to check your orthostatic blood pressure, specifically by name. Review your complete medication list at least once a year. Every medication, every supplement, everything. Ask your doctor or pharmacist to identify any interactions that might be lowering your blood pressure beyond the intended effect. And embrace the lifestyle factors that genuinely work. Regular physical activity, 30 to 40 minutes of walking each day, gardening, gentle swimming. An anti-inflammatory diet rich in fruits, vegetables, whole grains, and potassium-rich foods. Stress management through breathing exercises, gentle yoga, or time in nature. I had a patient, Mr. Albert, 76 years old, whose blood pressure was consistently between 159 and 161. His previous doctor was preparing to add a 3rd medication. Instead, we worked on his lifestyle. He started walking every morning in the park near his home. He drastically cut his intake of processed, sodium-packed foods. He practiced 10 minutes of deep breathing exercises each day. In just 1 month, his blood pressure had settled naturally to 132, without any change to his medications. 1 month. His body did what it was designed to do when we gave it what it needed. Here is the most important message I want you to take from everything I've shared today. You are not a number on a piece of paper. You are a living, breathing, remarkably complex human being with a body that has been adapting and surviving for 60, 70, 80, or more years. Your biology is unique. Your medical history is unique. Your needs are unique. The model of medicine that takes the same blood pressure target and applies it uniformly to every human being from age 30 to age 90, with no consideration of individual physiology, quality of life, or symptoms, that model is outdated. It is increasingly contradicted by the evidence, and for too many older adults, it is genuinely dangerous. You are not a passive recipient of medical decisions. You are an active, informed partner in your own health. You have the right and the responsibility to advocate for care that recognizes your individual reality, not just your chart number. The body, given half a chance, knows what it's doing. Our job, as physicians and as patients, is to listen to it. Don't let anyone treat you like a statistic. You are far too important for that.